What's up? Today, the question that I'm going to discuss is, could digital medicine be the solution to America's chronic disease epidemic? I think it's an interesting topic and an interesting paper that I'll get into because as I go through medical school and take the board exams and study, you realize that a lot of the medicine that we practice really is reactive medication, reactive treatments to the complications of chronic disease. And we know that healthy dieting, healthy eating, good sleep, eating nutrient-dense foods is really a way to prevent a lot of chronic disease. But the question is, how do we get prevention as a part of our healthcare model? And what these authors argue is that the current healthcare system really isn't currently designed to use preventive therapy over reactive therapy. What they think a potential solution might be, because of course it's way easier to poke holes in a system than propose solutions, they believe it could be digital medicine. So these are things like apps that interact with patients, these are wearable devices, these are new systems in place using technology that they think could be a solution to the chronic disease epidemic. So let's get into it. So the article is entitled, Digital Medicine's March on Chronic Disease. It was published in 2016 in the journal Nature Biotechnology, which is a great journal. And I thought it was interesting. It's a little bit old now, but I really think it's one of the best articulated responses on a solution to the chronic disease epidemic, and also arguing that digital medicine can be in there. I think that digital medicine in general has a long way to go. There's a lot of clinical trials that are currently going on, mostly focused on behavioral change, on behavioral modification through apps. I think that COVID actually accelerated the delivery of sort of remote and digital medicine therapies. So I think it's in a really interesting place, but I go back to this 2016 article because I think the authors lay it out really well. And let me start with a quote that they use in their introduction. Chronic disease affects approximately half of all adult Americans, accounting for at least 7 of the 10 leading causes of death and 86% of all healthcare spending. So that's a really striking sentence, and I think it sums up their argument really well. They argue that the thing about chronic disease is that most of this happens outside of the healthcare systems. The behaviors that lead to things like increasing risk for diabetes or heart disease, a lot of that happens in the outside of the healthcare system. You don't go to your doctor, for the 20 years as you're developing these risk factors, right? This happens outside the home. So they're really saying that perhaps we're missing the mark on preventing these diseases. And now let's get into some of the data. The top 3 causes of death in the 1900s, at 1900, were influenza, pneumonia, tuberculosis, diarrhea, and enteritis. Heart disease and stroke are actually 4 and 5, but we were largely up against combating acute infectious diseases. Now, in 2021, we see that the only acute conditions in our top 10 causes of death are from unintentional injuries and accidents or COVID-19. Keep in mind that suicide is actually number 11, and it certainly is not going to improve from a reactive healthcare model. Chronic diseases now lead the top causes of death in the United States, many of which are accompanied by near permanent damage, meaning that once you get to a certain state of disease progression, it's really hard to reverse it. That's what a lot of studies trying to do that are really creating new advances. For example, in NASH, non-alcoholic steatohepatitis, if you can reverse liver fibrosis, you're really doing something that nobody has done before. So a lot of the damage caused by fatty liver disease, for example, is something that becomes very hard to reverse. The authors then go on to talk about the mismatch between the current healthcare system and our disease burden, giving a justification for why is there such a huge discrepancy. The authors argue that though our model in the early 1900s was very successful, the development of antibiotics, antiseptics, understanding the bacteriological model of disease was really helpful for preventing these acute infectious diseases and also treating them. Vaccines, of course, included in that. And the system really was well designed to actually accomplish mitigating death from a lot of these conditions. But that exact system is designed to treat chronic disease as if it is a bacteria, as if you have an infection, you come in and there's an ability to stabilize and treat. But that's not the diseases that people are suffering from today. They think that the solution is going to require behavior change, frequent and personalized interventions, and solutions that can be effective outside of the healthcare system, meaning things that patients are doing in their own homes or in their own lives. The recommendations that a doctor can make, in a 30-minute visit is every few months, right? It's going to be really hard to have lasting behavioral change. So they think that frequent interaction, maybe with a digital health system, is going to be something that can help improve that disconnect between the doctor's recommendation and the patient's life. And the final thing I'll talk about that is they said, this really hasn't been possible to change the system in the recent past. The fee-for-service reimbursement model of our healthcare system is really well suited for acute care, but it inadvertently encouraged volume over value. So that's what the author's arguing, is that reimbursement for preventative care is not really widely utilized or accepted because that's not how the system was designed. Now, the solution, they think, really relies in behavior change. This is based on the fact that some of the most effective ways of managing chronic disease is through therapy systems like cognitive behavioral therapy, coaching, support groups. And because it requires a significant amount of time from clinicians to actually run those support groups or deliver that sort of therapy to patients, it's very challenging from an access perspective, and it also has been extremely challenging to scale that. Until now, they say. With wearable technology or technology that easily integrates in a remote setting where you can actually touch base and understand, for example, a patient's heart rhythm or how well they're sleeping or any other digital biomarker that you can think of, perhaps we can take advantage of this and recruit sort of different strategies that may not have otherwise been accessible to someone in a remote area or that barely ever interacts with the healthcare system right now. And then the question is, so why are we equipped to do this right now? The authors cite 3 particular advancements that will help deliver this new model of care today. The enactment of the Affordable Care Act is altering reimbursement and patient incentives. They say that now we're geared towards prioritizing value rather than volume. And the goals are to improve accountability in healthcare, advance equity, create value, and support care transformation. Patients will be increasingly requesting high quality but low cost health solutions like digital therapeutics. The second thing that the authors cite is that the financial incentives of employee healthcare. So nearly half of all Americans get their health insurance through their employer, and as health insurance reimbursement rates rise, it's been really hard for employers to actually find fair deals on their end. It's costing employers a lot more money in order to provide healthcare through health insurance for their employees. So employers, they argue, are going to be really incentivized to find any way to minimize costs through preventative strategies, and they think that digital therapeutics could meet that mark. And the third and final, sort of, in my opinion, more obvious thing is the technological advancement. This was written in 2016, before the AI surge and all of this sort of inundation with the development of new technology. And so, for example, today, 85% of Americans now own a smartphone, 77% own a personal computer or laptop, 77% of Americans have broadband internet in their home, and something that surprised me is around 255 billion app downloads worldwide happened in 2022. Just emphasizing how much technological access and innovation is going on right now. So in summary, the authors are saying that the successful design of a healthcare system to combat acute diseases is no longer equipped to deal with the diseases that we're suffering from today at a population level. We went from reacting to, we still are reacting to disease rather than actively preventing or actively managing these diseases. And by the time many patients present to the healthcare system, some of the damage has already been done. So the thought is that if we can intervene early, if we can intervene effectively, and if we can do it in a low cost and easily accessible way, perhaps digital therapeutics or digital medicines will be a way to to actually combat this exact problem. So I'll go into some future videos for examples of what companies are actually using digital therapeutics right now, in what spaces and what conditions they're treating. I think it's a super exciting space, so stay tuned.